So let's talk about our moral theories in regards to euthanasia. Utilitarianism, if you recall, utilitarianism says an action is right if it brings about the best consequences. So generally, if an act of euthanasia will maximize happiness, then utilitarianism will permit it. Okay? Just generally speaking, act euthanasia is going to say if this individual act of euthanasia is going to maximize happiness, then that's just fine. Every once in a while, you might find an act utilitarian who is going to claim that committing an act of euthanasia is going to be a problem because it's actually robbing the patient of any future happiness that might come about. So even though the person is dying, by not giving chemotherapy, okay, by the patient refuses chemotherapy, doesn't want to take it anymore, has made the decision for his or her cancer to run its course, and understanding that her life is going to end, there could be future happiness. Maybe she's going to get 6 more months with chemo, and she's only going to get 1 more month if she doesn't have chemo. Well, there are 5 months of happiness there. And by refusing treatment, there's happiness being lost. And so there are act utilitarians, again, probably not the majority, but act utilitarians who are going to say that future happiness needs to be had, and so an act of euthanasia would be impermissible. More often than not, you're going to find, an act utilitarian is going to say, look, is that happiness really going to be, is it really going to outweigh the pain and suffering from the chemotherapy, the agony of being sick, the, further pain of the disease, and so forth? So most act utilitarians are factoring all of that into the question of whether this particular act of euthanasia will maximize happiness. But there are probably some act utilitarians out there who want to really adhere to this notion of, no, we have to get all the happiness we can get. This is all contrasted with our rule utilitarians. Our rule utilitarians are going to be concerned that a rule that permits euthanasia is not going to maximize utility. Remember, rule utilitarians say we need to incorporate rules that maximize happiness, and an act is right if it's in accordance with that rule. But there's a big concern that if active euthanasia is permitted as a rule, there is going to be a significant problem down the line via abuse of the system, distrust of doctors by their patients, etc., etc. We're going to talk more about those concerns in a little while, but for rule utilitarians, a good portion of them could very well say the rule that permits this is not going to maximize happiness, so it is not permissible. Does that make sense? Deontology has different things to say. Remember, our deontological theories, Kantian moral theory, natural law theory, focus on the act itself rather than the consequences. So Kant would not permit euthanasia on persons because it doesn't treat them as persons. All right? Persons, on persons. Remember, we are rational beings. Kant says that we are due a certain amount of respect in virtue of being rational beings, and to impede that would be categorically wrong. This is, for example, so if we're gonna, somebody says, doctor, I'm in pain, I don't want to live anymore, would you please administer medicine to kill me? Kant's going to say that's not okay, because the patient is a person, and to perform active euthanasia is not acceptable because it does not treat that person with the level of respect that he or she is deserving of. Even when it's, voluntary, the patient is deciding. Kant is very, 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 very intent on preserving the life of persons. So killing, active euthanasia, is wrong. Passive euthanasia, he's going to have a little trouble with as well. Although, because hopefully the patient is deciding to no longer have treatment, we have to respect the person who's making that decision. Now, if the person's gone, it doesn't matter. Okay? When the individual is no longer a person, it's fine. So the individual in a persistent vegetative state, this individual is no longer a person, so euthanasia is permissible. Does that make sense? Okay, once that rational individual, once the reason has gone, then euthanasia is just fine. Natural law theory, on the other hand, is going to say euthanasia is never okay. One of those moral absolutes within natural law theory is you are not allowed to take a life. So euthanasia is never okay. But remember, we've got that whole doctrine of double effect. So there are times when administering pain medication can hasten death, but not because I've given him a lethal, amount. But things like pain medications like morphine suppress heart function. So in treating the pain and trying to ease the patient's suffering, the heart might become weaker and it might stop sooner rather than later if it wasn't getting the morphine, but the patient would be in far worse agony. So, because the intent is simply to make the patient more comfortable, the outcome of hastening death is recognizable, but that's not the intent. We're not giving a lethal dose to kill the patient. We're giving the patient smaller doses to help ease the pain. So the doctrine of double effect would permit that. So natural law theory is okay with giving medication that eases pain, even if the unfortunate byproduct is the patient dies 3 days earlier rather than living the other 3 days and not getting the medication and being in pain. Does that make sense?